We're here today to talk about what I think is one of the biggest issues in the federal election, the future of our healthcare and aged care and Medicare.
Well, today we got together with a local community council group, our union, Nurses Midwives Association, together to talk about federally what's happening with Medicare, the attacks to Medicare and how we're going to fight back.
We have invited the politicians here. The only one that didn't turn up was Louise Marcus.
Medicare has done this country well and should be allowed to do so in the future. We shouldn't let the old idea of user pays come into our health system, and we've got to maintain access to high quality care regardless of capacity to pay.
All Australians have the right to quality health care, and this includes our older Australians in residential aged care facilities.
And what does our government offer them? Nursing homes that are geared to make a profit and have no requirement to provide adequate and qualified staff.
The main concerns are the quality of care in aged care and also the funding.
We fear that cost-cutting by removing registered nurses in aged care will result in a sharp erosion of care standards. We need more RNs in aged care, not less.
Society can be judged by the way they treat the elderly. Health and aged care are community responsibilities, so it's our job to ensure that those who have given so much to society are treated with proper care and dignity when they are approaching the end of their lives.
And the quality should be a lot better, the wages as well.
Nurses working in aged care are paid at least 10% less than their public hospital counterparts, and will be lower still if penalty rates are removed.
The candidates' response were quite good.
There are two things that I believe are important in life: health and education. And I believe that they are not negotiable.
The ideology that engulfs our government, the neoliberal way of looking at the world, means that there's this reluctance to employ people, professional people, and pay them properly. In health and aged care, we're suffering the death of 1,000 cuts. That's the way they do it.
Susan was more outspoken about what she was going to do.
From Labor, what you're going to see is that a belief that every Australian deserves quality health care. You should be able to access these when you need it and where you need it. We will be the ones fighting to protect Medicare. We created it. We will fight to the death to make sure it stays the model of universal health care in this country.
And we need Medicare to cover primary care procedures like pathology, pap smears, mammograms. They are really necessary and we must keep them.
We need more passion and more genuine concern and less economic rationalism and neoliberalism determining our health policies and our aged care policies.
They all said that they were going to fight for us.
With the exception of the sitting member, I think the message did get across to the candidates, and I hope the message got through to the community group people that came along so they can spread it verbally, and if not, leaflets, websites, whatever. But yeah, bring it up in conversation.
If only I have the power to make a positive change to aged care, I will make this registered nurse requirement permanently embedded in our legislation and extend it to all aged care facilities in Australia. Because all Australians, not just those in New South Wales, have the right to safe quality care. These are the solutions that I would bring into force if I had the power, which is in your hands.